The central nervous system, which is composed of the brain and spinal cord, plays an important role in managing our thoughts, emotions, and body functions. When disorders appear within this complex system, CNS drugs become important to manage the symptoms. One of the most well known types of CNS drugs is antidepressants. These medications are prescribed to manage depression, which is a common mental health condition characterized by continuous sadness, loss of interest, and other related symptoms. Antidepressants work by modulating neurotransmitters in the brain such as serotonin, norepinephrine, and dopamine, which are responsible for regulating mood. By altering the levels of these chemicals, antidepressants can help reduce depressive symptoms and improve overall well being. Another class of CNS drugs is anxiolytics, commonly known as anti anxiety medications. These drugs are prescribed to treat various anxiety disorders, including generalized anxiety disorder, panic disorder, and social anxiety disorder. Anxiolytics work by targeting certain receptors in the brain, such as gamma aminobutyric acid receptors, or known as GABA receptors, which help reduce excessive anxiety and promote a sense of calmness. Another class is the antipsychotics, which are prescribed to manage conditions like schizophrenia and bipolar disorder. These drugs primarily target dopamine receptors in the brain, helping to control the transmission of this neurotransmitter. By doing so, antipsychotics can alleviate symptoms such as hallucinations, delusions, and disorganized thinking, restoring stability to individuals with these psychiatric disorders. Another group of CNS drugs is the CNS stimulants, which are primarily used to treat attention deficit hyperactivity disorder or ADHD. Stimulant medications work by increasing the levels of certain neurotransmitters such as dopamine and norepinephrine, which play a role in attention and impulse control. By enhancing the activity of these neurotransmitters, stimulants can improve focus, reduce hyperactivity, and enhance overall cognitive functioning in individuals with ADHD. Lastly, we have sedatives and hypnotics, known as sleep aids. These medications are prescribed to manage sleep disorders such as insomnia. Sedatives help promote relaxation and reduce anxiety, while hypnotics help to induce and maintain sleep. They work by targeting specific receptors in the brain, such as GABA receptors, to facilitate a state of tranquility and facilitate a restful night's sleep. It's important to note that the use of CNS drugs should always be under the guidance and supervision of qualified healthcare professionals. These medications can have various side effects and interactions with other substances, emphasizing the importance of appropriate prescription and monitoring. In conclusion, the field of CNS drugs involves many medications that target different aspects of neurological and psychiatric conditions. From antidepressants to anxiolytics, antipsychotics to stimulants, and sedatives to hypnotics, these medications offer hope and relief to individuals suffering from various CNS disorders. By understanding their mechanisms of action and working closely with healthcare providers, we can optimize their benefits and pave the way for improved mental health and well being.